Namaste. Actually, many parents are concerned about their kids when they go for assessment. They are saying that, doctor, when I have done assessment in that center, they are saying that it is a moderate autism. In your center, they have assessed and they told it as a mild autism. In somewhere they have done, then diagnosis came as it's not at all autism, it is ADHD. Why this happens? Many are having concern in that. The main reason for that is usually parents do assessments. What we feel is if father is sitting for assessment, the assessment report will change. If mother is doing assessment, the assessment report will change. So, what happens is it's according to the mindset of the parent, the assessment report will change, because some parents will, the situation will be very mild, but they will explain it as a severe case. In some situation, the situation will be very severe, but parents will generalize everything. So, ultimately when a psychologist asks for this scoring, it is up to their mindset, the assessment report will change. So, we will come to know that it will not be a final thing. This ISA, VSMS, CARS, REELS, whatever the assessment, it may not be 100% perfect. So, what we do over here is we do the normal assessment, along with that we do the assessment of a parent. We need to know what is their mindset, what is their body constitution. The third assessment what we do is we give, our professionals will give a 3-4 sessions of therapy. It is called a therapy assessment. In that therapy itself, they will give some task and they will see how much the kid is doing, and accordingly they will fix, okay, whatever the parent has told, how much it is applicable, or whether it is practically it is there or not. So, first assessment, second assessment of a parent, third assessment, it's a practical kind of assessment, so that the exact diagnosis we will get. And what is the need of diagnosis, that also many don't know. When we are able to diagnose the case better, we can plan the therapy. In the sense, if speech delay is there, sometimes they need to be given a sensory integration, sometimes we need to give behavior therapy first before giving speech. To plan that, diagnosis is the main thing. Otherwise what happens is, we will give speech therapy for 6 months, within 6 months we will not get any result, then they will plan for OT and the sensory whatever. So after 3-4 sessions, 3-4 months of therapy only, we will come to know which therapy is helpful for kid. If we need to overcome that, diagnosis is better, then plan for a 3-month therapy. In that, preference 1, preference 2, preference 3, which therapy has to be given preference, how much weekly, how many sessions we need to give, and what should be the goal, so that every month we will get the change. Otherwise, every time they will be in the same circle, in the same that circle itself they will be there. We can't get out of that circle, we will not go to the next orbit. So just keep this in mind when you go for therapy. Namaste.